So can I share my screen, please?
Yes, you can share your screen. You can go ahead. Thank you. So for those of us on the call here, this is for health informatics. You should be able to see the other rooms for other sessions. So if you are waiting here, that means you are in for health informatics. If you are not, please find the rooms for other sessions. Thank you. Yes, there are other sessions aside from this. So, isn't it? Are you able to share your screen?
No, you're still sharing your screen, so I'm not able. So you have to stop sharing for me to
Oh,
share.
okay, okay. So
It would
let's
be
go ahead
nice
and
to
take
have
it.
someone in the chat that keeps telling people this is for health informatics and how to find the other breakout rooms as well.
Sure.
Okay. I believe it's afternoon. Yeah. Good afternoon, everybody. I'm going to put on my camera for a few minutes. Or I can leave it on the rest of the presentation. So this is me, and if you're here for the health informatics session. So we're going to have a chat, very interactive chat about getting into the health informatics pathway or career pathway in Africa, because this is an African platform. And the interesting thing is that career pathways differ according to the region. If you read the World Economic Forum Future of Jobs, let me just share my screen, Future of Jobs report that just came out, you can see that in as much as the general outlook, you still them breaking outlooks down into regions. So it's important to make that distinction that this is generally tailored towards the African continent, because I'm a health informatics specialist
targeted by your product or service and within your reach.
And what I do every day, it's not what health informatics in Nigeria or say in South Africa, informatician in South Africa or Nigeria would do. So this is very much tailored towards what you can find or how you as someone who lives in Africa. So this is not because this is not a general global, I'll chip in some things globally, but this is exploring health informatics career pathway in Africa. So welcome. And if you're here for health informatics. So my name once more is Izinawakwe. A pharmacist by training. I'm currently in the health informatics space and also the founder and executive director of Digital Health Skills for Africa. So to start, I just want to know what's your background. If you're here, put in the chats, what's your background? Not in the chats, just put this, go to slido.com, put in the number 37281166 and tell us what your background is. Let me know the people that are here. So let's put this, go to slido.com. So we're going to do this a lot today. So just have your slide already. 37281166. I just want to know the background of the people who are in the class. Are we doing that? Okay, someone is typing. So let's start. Physiotherapist, beautiful. Any other person? I think we should all be using Slido now for workshops, for seminars, for webinars. So let's see your responses. Let's try to make it as quickly as possible. Physiology. Wow, these are really out there, not even the traditional pathways. So physiotherapist, physiology, If you're a student, you can put in brackets student, medicine and surgery. Are you a student, medical analyst, and let me take this up a bit. Beautiful. Informatics at intern, okay. Physiology student, okay. If you're a student, put in bracket that you're a student. Any other person writing? Medicine and surgery, medical interns, graduate, medical doctor. Okay, keep typing. The number is in the chat. We have 7 people who are put in the poll. So keep typing so that we don't take a lot of time. We have a lot of discussion to have today. And we want to keep this moving along. So we'll come back to this slide. So just keep putting what's your background in the chat. That is the question on Slido. Health information management professional, health informatics student. So you are also even in the, you're in the, I didn't even know there were, so there were health informatics students a lot in Africa like this. I know there's HIM definitely, but so the health informatics student, I don't know if you're within Africa, that would be nice to know if you're in Africa or not in Africa. I know there are very few schools that do health informatics in Africa, even at the postgraduate level. So, pharmacist is leading, midwife, registered nurse, probably mental health nurse, mental health, so pharmacist, midwife. Okay, I can see that happening. So we'll come back to this slide. Just keep putting in your background. So now you've told me your background. Okay, mental health nursing student. Eko Mama, beautiful. Congratulations, not easy to be a founder. So I just want to tell you a bit of mine as well. Now you have told me your background. So this is my background. It's just also to tell you that no one has, you come out and this is what you get into. And like you have a linear career pathway. I joked about this a lot, that the only person I've seen that's worked in one company for more than almost 30 years is the CEO of Nike. And he started as an intern and worked his way up there, went retired and was brought out of retirement to become the CEO of Nike. And that is like one in a million, really. Most people have very convoluted career pathways, and what you studied might not be, especially in this part of the world where it's like, if you're in Nigeria, you say NYSC happened to me, or they gave me this course in the university. This is not what I wanted to study. And this is what I ended up studying. And so you have to make the best out of it. So once someone's audio is on, if you can help me mute that, please, that would be nice. It's a bit distracting. So I studied pharmacy, like I said, and then I ran a DRF, drug revolving fund, for 1 year as a community pharmacist. And then I went to the African Union straight after that, after 1 year of graduation, and went into international organizations. So working for the Africa CDC, and firstly to operationalize the regional office in Zambia, and that involved also coordinating emergency preparedness and response activities in that region. So I'm a pharmacist to start with, and then I went into project management, went into strategic leadership, and went into public health proper. So when I got to Zambia, the first thing we did was a cholera outbreak ongoing, and I was just in the midst of that. And that became my work for close to a year, because it was really huge in Zambia then. So I was a public health officer for emergency preparedness and response in Zambia while trying to operationalize the regional office for that. And after that, the Ebola wave came, the first Ebola wave then in DRC, and we helped set up do the preparedness and response for Zambia, and then still went to Uganda to support Uganda, because Uganda had an outbreak as well. So that was still emergency preparedness and response. I was still very much into public health, working a bit with data, because you can't work in public health and surveillance without data. So that was me gradually getting into the data bit of it. And then because I was doing a lot of projects and managing projects, I decided to get a PMP. That's a project management professional, and that's going to come in handy in our conversations later today. and then got a postgraduate studies in public health. So you can see that the experience came before the education. Again, the education can come before the experience can come before the education. And so I decided to get this because you also have to look at the local context as well. These things are things we're going to talk about much later as well. So we're learning from this, my little experience I'm sharing of myself and my background. So it's not just to tell you this is or brag, this is what I've done, but let's learn from it as well. So you can have the experience come before the education. You can have the education come before the experience. And you can also decide to look at the context. Where I am, do they value certificates more or do they value skills more? And in Africa, Africa really values certificates as much as they value skills, they also value certificates. So I knew that if I needed to get ahead in my career, I needed to get something on paper to show that I had those skills. Because you can't get into any international, if you're going to be in that international organization group, you're going to hear that it's really difficult to get into any of those organizations without a master's. So if you look at any posting now, P3, P2 posting, I worked in that space of any organization, you see that they were asking you for, if you have a bachelor's, then you have to have 10 years of experience. If you have a master's, maybe 5 to 7 years of experience. So I looked around and I realized if I wanted to go far, I needed to get some paper to back my extensive experience that I've gathered in this area. Remember that I came from a pharmacy background and now I've gotten into public health proper and I'm managing products and projects. Then the COVID years hit and I became the COVID-19 vaccination, in fact, the vaccine program manager, not even coding COVID-19, the vaccine program manager, program coordinator for Africa CDC. And because it was COVID then, I was mainly focused on COVID-19. We had other programs enrolled in the pipeline that are coming to fruition now. And that was my foray, my really big foray into healthcare data analytics and informatics, because the major thing, one of the most visible projects we had to do then, amongst other things we had to do in that portfolio, was to work on the vaccination data analytics, to put out the dashboards, to track the vaccine, the numbers, the vaccines that are coming in, people who are vaccinated, anything that had to do with the vaccine in terms of numbers, you had to track that and make sure that the decisions are being made by the African Union government and leadership was based on data. So that was my work then, to coordinate that and to make sure that happens. And actually to do the work, because there wasn't really a lot of people who were, Africa CDC wasn't as robust as it is now. So we're really very few then that were doing the work. So you actually had to do the work yourself. And then while doing that, I became a technical advisory to FIP. FIP is an international organization for pharmacists. So that also comes into play, like you leveraging mentorships and networks to build your career profile. And then I decided to go back to school to get some education in analytics proper, because the healthcare data analytics, the education I got there was mainly from a boot camp, a very good boot camp I did, and more self-study as well. And then I got my education in business analytics and became a clinical informatics analyst, and now I have my NGO. So this is just to tell you that it could go both ways. It could go any way. This is my own pathway, and this doesn't have to be your pathway. Some of us could come from this to straight and get into an informatics job, or you could come out and go from this one to this one, but your eye always on the prize. 5 years ago, I didn't even know that the word health informatics existed. So, but now I'm very much in that space, playing that space both in Africa and in Canada, where I live at the moment. So it's just know that it could go anyways. So it's not just that this is what work for this person, it has to work for me that way. So this is also me just telling you my background, and we're learning lessons from it. So thank you. Let me go back and see what you've shared. Pharmacist is still leading the poll. We have 12 people who have shared. Okay, beautiful. So I know the people who are here: med lab science, nursing, medical doctor, physiology, medical. So everybody here is on the medical background. So we are looking for that tech bit to help us get to the informatics, medical, to combine that IT and tech, IT and healthcare and computer science to get to the health informatics bit. So let's start with what health informatics is not before we go into what it is. First of all, it's not, because most times, because in Africa, I'll keep saying in Africa, because I'm trying to contextualize this. It's health informatics on its own. It's not as old as medicine or nursing or as any of these legacy courses that people are doing or you studied in school or you're studying in school. It's not as old as them. This is something that is probably 20, 30 years old, which is relatively young for most of the courses that you've done. And it's even newer for us in Africa, and we're just beginning to realize that we need these skills. These are unique skills that we need, because the way the world is going, IT skills are necessary. We can't have somebody doing healthcare separately and IT separately. We need to have someone who has that skill, bring it together in one person. It's utilizing resources in a more efficient manner. So you have that happening. And so what health informatics is not is, it's not tech support. It's not someone who works on our laptops in the hospital. No, it's not IT support. It's not someone who fixes our laptops or who comes to check if we have virus or jumps to do things for us in the on our laptops in the hospital. No, that's not health informatics. It's not data entry that we're entering data into the laptop, into the system. It's not data entry. That's not health informatics. Neither is it software development. So it's not that you're developing any software or you're building apps and you say a health informatician. It's not. It's also not health information management. I know someone studied health information management here, and you can see there's a bit of difference between that. So health information management is a bit more technical, leaning towards more on the technical side than health informatics, because it deals with how it's stored in the database, how healthcare data is stored in the database. Is more of the database management, the tech side of the data management than the science of it and the healthcare bit of it. It's also not really data analytics. Data analytics is a core part of health informatics, but it's not data analytics per se. And also, it's not limited to clinical settings. So this is what health informatics is not. So now the question I want to ask you guys again, go back to Slido like we just did the last time. We're going to do Slido a lot, remember. Maybe not a lot, 2 more times, forgive me. What do you think now health informatics is? Now we said what it's not, remember. It's not IT support, it's not data entry, it's not software development, it's not HIM, it's not data analytics per se, it's not limited to clinical setting. Now you've seen that Venn diagram over there where you have the computer science, information science, and healthcare. So tell me what you think. Someone was typing. Please just continue typing. What health informatics is. A sentence, a phrase, a word, whatever it is. I think I didn't make this anonymous, sorry. Computer science and HIM, okay. Someone else can tell us what they think health informatics is. And the beautiful thing is, I'm not going to come out and give you this as a textbook definition, because like I said, it's different in terms when it comes to, we're talking applied here. So bridging or mixing care. Okay, I think I should have made this a longer answer. Bridging, maximizing care proportional benefits gaps in healthcare. Okay, I think I can make sense of what you're trying to say. Or you can use the chat because I made this a short answer thing. So let's use the chat. Okay. Oh, there's someone from computer science. Beautiful. Okay, HIM operation support. Okay, so we have someone who is from the IT side going into the medical side. Okay, at least you have somebody like that. Okay, beautiful. Let's see more things. Okay, health that are being used to inform healthcare decisions. Okay. All right. So, what is health informatics? Really, health informatics, like I said, is an interdisciplinary field. That's the first thing you have to realize. So it's not, I go to school and I study one thing, and then it's the use of IT in healthcare services delivery to enhance patient care. Great answer. Beautiful, Yasa. That's nice. It's an interdisciplinary field, like I said. So using IT, he's brought in IT in healthcare services and delivery in it to enhance patient care. And it's continuously evolving. So it's interdisciplinary because if you look at that chart there, you had computer science, you had healthcare, and you had information science. So it's information science is data analysis and all of that. Computer science is a bit of programming and some analytical things as well. And of course, you have your domain knowledge in healthcare. So, and when we talk healthcare, we don't mean doctors. We don't just mean nurses. We mean people from physiotherapy. We have people here from mental health field. We have psychotherapists. We have psychiatrists. We have pharmacists. We have midwives. So healthcare as healthcare domain, not just as medicine. So it's continuously evolving because the world as we know it now, anything that has to do with tech, it's a career that is continuously evolving. It's not static. So health informatics is very much layered and bothered around tech. Someone, Nick Raphael, also said that health informatics is the intersection of healthcare information technology and data analysis, focusing on design, development, and implementation of digital solutions to improve. Wow, 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 wow. This looks like a ChatGPT response, but I believe you that this came from your head. But this looks very, very textbook. Well, that's nice. Yeah. So the intersection between healthcare, information technology is coming out. So IT, healthcare, data analysis, beautiful. And you realize that this, when you get all of that, it now builds into you implementing this to improve healthcare, which is the second part of what I want to talk about. It deals with the acquisition, processing, interpreting, and using healthcare data by domain experts. And the purpose is, no matter the definition you give us here, the purpose of health informatics is to increase our understanding of medicine and medical practice by using real-world medical data. So you use the data to improve the practice. So it's not just, that's why I'm saying data analysis, it's not health informatics per se, because most times data analysis, we stop at data analysis. So what happens after that? So yeah, data-driven decisions, does it affect patient care? Does it improve anything? So what, is there a better understanding of the practice? Our workflows improved? So what happens next? So I like your definition, Raphael. It's very spot on. It's very wholesome. And in as much as it's textbook, but I just want us to understand that, yes, it's a combination of this and implementing solutions to improve outcomes. So there's an end goal, which is to improve outcomes using the data that we have collected, the information that is from the healthcare space, and we have gone through that umbrella of that corridor of implementation to improve healthcare outcomes. So the next thing we want to talk about, because all this is just to lay ground rule, we want to talk about the career path and have a conversation. I want us to really unmute and chat. So this is going to take like next 15 minutes and we'll have a conversation. So HIMSS, it's an international organization that is called Health Information Management Science Society. It's an international organization that kind of tries to coordinate everything health informatics globally. So they came out, what I put HIMSS there is that they came out with this. There's so many, if you go online, you're going to see so many branches of health informatics. But because it's an internationally recognized organization, so I said, let's go with their own breakdown. So there's clinical informatics, which is the area that I'm currently in. I used to be in public health informatics when I was at Africa CDC because I was working in the public health space. Now I'm in the clinical health space. And what I do in the clinical health space is that right now the projects I'm working on is to digitize the healthcare system of a whole state. If you're in a a country that calls it province is called province. If a country that calls it state is a state. So all the health records, everything, electronic health records, all the hospitals are going to be linked to one record system. So if you go to one hospital, your information can be viewed in another hospital. So that's what I'm doing right now. So I'm working as an clinical informatics specialist in that project. So it has to do with hospitals, hence the name clinical. Consumer health informatics has to do with healthcare goods. Nursing informatics obviously has to do with nursing. So people that have to do with anything nursing and data. So now we're breaking down the healthcare bit into domains, but then you still have the computer and the information science bit still there. So now it's the healthcare bits that you're breaking into domains. So pharmacy informatics has to do with the supply chain, procurement, logistics, drugs, all of that, prescriptions, data around all that. And then public health informatics has to do with, of course, public health data, which is what I was doing before to influence patient positive public health outcomes and influence public health decisions. So these are the branches. There are more. You could see, go online and see so many much more, but these are the key ones and others can fall within this umbrella. So why do we have to consider health informatics in Africa? Don't we have public health already? Public health is very common. We have data analysis in Africa. So why are we bothered about health informatics in Africa? So the reason for one thing I'm just going to say is there's a growing need for digital health solutions across the continent. And so that's why health informatics is necessary, because in the digital health space, like I said, data analysis is not going to just cut it. Public health alone is not going to just cut it. You need someone who has the public health skills, who has the data analytics skills, who has the project management skills to bring all that together, tie it up, and give you one person, like one outlet. So it's necessary as we're coming up with digital solutions right now. The digital health transformation is happening, is exploding across the continent. And so there's a need for these skills. So wondering, with your skills, just go on LinkedIn now. Before, about 3 years ago, I searched health informatics as in as a job title even. It's so difficult to see any job title health informatics, but I tried that yesterday when I was finalizing this presentation and actually saw a couple of jobs on LinkedIn with the title health informatics. In as much as we don't call it health informatics all the time, it could be called clinical informatics, it could be called other names you're good, like you're going to see further down the conversation. But you see more and more organizations are beginning to carve out that niche for it, because you need to bridge the healthcare the digital divide. So these are the key aspects of health informatics careers in Africa, because we need to bridge digital divide. The telehealth movement is great in Africa right now. So you have to bridge the divide between the rural and the urban areas. And someone with that skill of a health informatics who needs to analyze that data, who needs to do the software bits as well as the healthcare bits. So who has that knowledge of both bits, programming and healthcare. Like I said, there are so many things can be called, and we're going to see that much later. So data analysis and reporting, these are the key aspects of health informatics careers in Africa. You bridging the digital divide, there's data analysis and reporting. So if you're having a career in health informatics in Africa, these are the key things you should know or you are going to get into. You're going to bridge the digital divide. You're going to be talking about things that have to be urban and rural, connecting both. You're going to get into data analysis and reporting. You're going to go into system implementation and training. You're going to go into telemedicine, telehealth development, health information security. So now with everybody going digital, everything on the clouds, cybersecurity is very key. So anybody with cybersecurity skills and healthcare, man, you're going to be in a lot of money. And of course, like making sure that privacy and integrity of patient data, because patient data it's like gold right now. And interestingly, the biggest breach we usually have and the most common breach we have in the data space is actually healthcare data, because it's very, 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 very crucial. And with that, you can access a lot of people's information. So having that skill of cybersecurity and healthcare it's gold mine if you're in the African healthcare space. So these are the key aspects of health informatics careers in Africa. So what are the things you're going to do, kind of like what I just talked about before? You're going to retrieve and store healthcare data to manage healthcare data, analyze healthcare data to identify trends, develop and implement health information systems. So like the EHR. So here in Africa, we have some private patient portals of different solutions, but we also have open source records, open source health records like the DHIS2, the Open MRS. So those ones, if you know them, those are tools we're going to talk about that you should actually know. And of course, you have to ensure security and privacy of health information, using technology to improve communication and collaboration among healthcare providers. So I just wanted to touch about, like I said, everybody's day is different. So day in the life of a health informatics specialist or any clinical informatics specialist, it's a lot of things. In one day, I have loads of meetings. My main goal is to be the go between the software developers and the end users, which are the clinicians. So the people building our software for the digitization and the clinicians, I'm the go between. So I need to have a knowledge of the software, clinical knowledge to be able to convey what these people are talking about to these people, and the other way, so to make sure that that conversation happens. So I gather and analyze data, I design and review workflows. Workflow is how does an order go through in a hospital? How does a patient go through in a hospital? That's what a workflow is called. So workflow, how does it flow from one place? So if it's an order, a drug you're prescribing, how do you go from ordering it to the patient receiving it? That process is called a workflow. The same thing as when a patient is admitted into a hospital, how does the person go through the hospital to discharge? The person is discharged, that's a workflow. So same thing as I do using unit testing as well when needed. Unit testing, you test the system to make sure it's working well. You do trainings and then you manage the system. So that's kind of like a peek into my day. And so we've talked about all these things now. I hope we are on the same page in terms of, so I want to see in the chat a yes or a no if we sort of understood, getting an understanding of what health informatics is about before we start talking about the skills we need to succeed. So let's see it in the chat. Yes, no, do we understand? Are we getting, I can only see one comment. So I need to see feedback. Are we getting, do we understand? If you don't, I would explain again. If we beginning to understand what health informatics is and why this can be a lucrative career pathway, because it's also about the money. So you have to be motivated by something. The need to make a change, either you're motivated by the zeal to make a change, or the pay is going to get you, the recognition you're going to get, one or two, or all three. So, but something needs to motivate you to get into a career pathway. If not, you're not going to persevere. So if we get an understanding of it now, we're seeing, like I said, computer science, information science, and healthcare. And healthcare can be any background in healthcare. Now, what skills do you need to succeed? There are three areas: the technical, the soft skills, and the domain knowledge. Recently, I did a post on soft skills. I'm very particular about soft skills because I've seen it like, and that's why I highlighted project management skills. Like that's one skill that I've used most. I have programming knowledge, I have analytical skills, I know how to use DHIS2. I don't know much about MRS, but I use DHIS2 a lot. I've used Epic. This part of the world use Epic and Meditech. Actually use Senna where I work. But you see, project management skills and change management, those are skills that have saved me a lot. So technical skills, definitely. Now you don't have to be a guru in programming. Like you don't have to have it like this to be able to succeed. In our world today, you can get away with AI with a lot of things. So but of course you need to understand the concept of, this is me talking sincerely. You need to understand the concept of how the codes run or how to even code. And of course, there are also non-code tech. There's code and non-code tech. Now, if you're talking about the code text and its programming, which is what most of these processes or these tools that we use in this healthcare space run on. You need Python, you may use Java, you may use HTML. There are so many of them. I just put Python and R there, but there are so many of them. So if you know the other ones, please, whatever the organization uses, you learn the one the organization uses. There are so many courses online. We'll get to that. So proficiency in computer science, some programming knowledge, and that's what the computer science is. Programming knowledge. I didn't study computer science. I have still not studied computer science. I just know how to program. I know Python, I know R. Database management, SQL is very important because in healthcare, data is disparate, like it's in different sources, and it's a problem. Interoperability is a problem in healthcare. So that's why our data is always here and there and the other place. So you need to know SQL to be able to bring data into one place. So that's one tool skill or one tool you should really know how to use. And of course, Excel, if you're very good in Excel, not just basic plus minus Excel, advanced Excel, even using VBAs to automate your processes. So if I'm going to advise anybody to go learn some tools is go learn Excel, very advanced Excel, SQL, pick between Python and R, depending on the organization you're targeting, what they use. Pick one, learn how to prompt engineer. So even though you know how to code, learn how to prompt engineer, and then the Power BI tools as well, the visualization tools. And then the DHIS2 platform is open source. You can actually go and learn how to use it. I know there's a DHIS Academy that does courses on DHIS2. So anybody in Africa, DHIS2 has taken over Africa right now. There's open MRS, yes, but DHIS2 has taken over Africa. It's in a lot of places, the open source tool that is being used for data management and EHRs. So that's important to know. Go learn these tools. And in terms of soft skills, these are the soft skills that you can have. And get this project management. PMP is very good to have, but it can be costly to get. So if you can do one of these Coursera project management courses, that would be very helpful for you because to help you learn problem solving skills, all your soft skills, you can learn it from project management because you need to influence decision making. And then understanding healthcare concepts, medical technologies and workflows, regulatory requirements. And you can go from a clinical background, then add the IT training and get to where you want to go to. I also saw someone who's in computer science. So what you need to do is take some courses in healthcare concepts, medical technologies and workflows. There's a lot on Coursera and edX. And those, get the good ones. Don't just do anyhow course. Look for the good ones, pay that bit of money or apply for a scholarship on those platforms and get the medical, just learn those processes, like show that you know the medical bits, or you look for an organization that is not very you see the organizations that there are where you can actually plug yourself into more the technical bits than the medical bits. So these are the skills that you need to succeed. So you can take a screenshot of this. These are the key skills you need if you want to succeed in this area of health informatics in Africa. So other background, whether you're clinical or you're IT, you just have to get the other one to augment what you have. So how do you get started? Degrees. So have a degree in a healthcare background, health sciences. If you have a degree in health informatics bachelor's, but I really doubt there's any degree like that in Africa. I checked around. I saw something in University of Cape Town, but it's a master's program in computational informatics. And then also saw something in University of KwaZulu-Natal in health medical informatics. Saw something in Makerere University, Uganda. Also saw something about a Center for Digital Health and Health Informatics in University of Nairobi. So these are the schools I've seen. If your school, I didn't mention your school, I'm sorry, but these are the ones that I saw when I was doing some research for this session. So, and most of them are in the master's angle, like they are postgraduate studies. So what you can do is get a health related health sciences, any of the health sciences is fine. Public health is good. Even having a master's in public health exposes you to a lot that those in health informatics will get. And then you can acquire these other skills as you go along, like I did. And then certifications that can help you, you have CAHIM. So these are certifications that you can look out for, but CAHIMS is a very good one to start with. This one here, the CHIMS, is also by HIMSS. It's very introductory. If you're getting to the space, it helps you get into the space. It's not high level. If you want to get really highly certified, you can look for CPHIMs. And also, I know Helena is trying to revamp their websites now. They used to do courses in the past and certifications, not really certificates, but not really certifications, but certificates, which was very good. And they have a conference this year. So it would be nice to see what they do going forward, because I think they want to revamp the organization, or they revamped the organization. So that would be nice, because Helena kind of like coordinates, or is the body that represents International Medical Informatics Association for the continent. So you can check it, Helena, HELINA. So these are some of the certifications that you can look out for. And like I said, PMP is also there again. Project management is very important. So these are health informatics or healthcare data specific certifications. And you can look for online courses. I've done this healthcare informatics specialization course. It's very nice. It's on Coursera. It takes a while, but it's very nice. It exposes you to what the field is. Some of it is a bit westernized, but you can pick what you can pick for you to adapt to the space you are in Africa. And then there are boot camps that do courses in health informatics. So you can look at WHO websites. The ITU, International Telecommunications Unit of WHO, does some courses sometimes on health informatics and digital health. So you can also look at that website. I think AMREF also does something in digital health. So when you look at digital health training aspects of some organizations, because that's where health informatics falls in. So you can see some health informatics trainings as well there. And then why I put internship practical experiences, that these spaces, you need to show people. You cannot just tell us you've done this. You need to show. So you need to have like a portfolio of the work you've done. So if you want to do, you can go to Google, not really Google, go to ChatGPT or Bard or Gemini and ask them to give you, yeah. So, okay, I'm just looking at the chats. Yeah, exactly. So MSH in medical informatics at Quantum Hunter, they have yeah, exactly. I think that I was right about that. Him since it's expensive to be a member, but they have a student platform. You don't even have to be a member to stay. But you can do the CAHIMS. So sometimes they have scholarships for their programs, and you have to retake the exam every other year. So HIMSS is a bit pricey. And that's why I'm hoping Helena really steps up and takes, I'm glad they're sponsoring these projects. They step up and actually help us, because HIMSS is very expensive. Really, it is very expensive. The health informatics courses, just go online. I can't give you links for everything. I've actually really written down, it's on Coursera. The title is Health Informatics Specialization. The second one is Health Informatics for Healthcare Personnel. So look out for these two courses. I've told you the websites to go to, WHO ITU. Just search for digital health courses in WHO, AMREF, WHO ITU, AMREF, and these are some of the courses you can also get here as well. So let's speed up and then do projects. Go to AI and ask them, what project can I do, or what thing can I do in the digital health? If you have questions, you can put them in the chat. Like I'm answering as I'm going along. What projects can I do in, so that's how to optimize, that's how to prompt engineer and get AI to do the job for you. So what projects can I do? I'm trying to get into the health informatics space, and I want to do a project. So give me ideas of projects that I can do in this space to get some experience. So you'll see some things may tell you, and then it can give you step by step on how to actually do the project. And you can carry it out and put it in your portfolio as things you've done. If you can't get a job, sometimes they ask you for experience and you need the job to get the experience. So this is how you can get the experience, is by doing projects by yourself. So how can you even get ideas for a project? Use artificial intelligence. So it's not by just Googling how to write essays and how to do this. You can prompt them to help you ideate projects, and then how do you carry out those projects, and you go by step and help you through the process after you've done this courses, so that you're not just walking in blind. So that's one way to get onto the platform. Then networking, of course, like I said, I keep talking about Helena. If they really come back strongly, it's great to really get on board what they are doing. It's a great body to be part of. And I know some organizations, I know someone in Kenya that is in the Kenya Health Informatics Association, and they are very strong in Kenya. So if you're in Kenya, look for Kenya Health Informatics Association. And check also if your country has a very strong Health Informatics Association, join them. And how do you find these people? Just type health informatics, or type health informatics on LinkedIn. I use LinkedIn as a deck. So type it and then search for people, and you find people who are health informatics people, and you can find out if they belong to associations. You go down to associations, organizations they belong to, and see if they belong to any organizations that you can join. And why you need this is you need the network to know what's going on in your country, because these are context-based. So I attend health informatics conferences and webinars like this one. Helena has a conference coming up. Check it out online. If you can attend, it's in Botswana. You attend. If they have a virtual option, please participate. And I'm not sure they do. Mentorship, of course, virtual coffee chat. Don't go on LinkedIn and start typing, I want you to be my mentor, this. Ask for virtual 10 minutes virtual coffee chats with people. It's enough. 10-15 minutes. I just want to talk to you for 15 minutes, one-off, and that's it. You can learn enough from the person. If you search through and you find health informatics is on a person's profile, and the person is in your country or is in an industry you want to get into, go and ask the person instead of asking, please be my mentor, ask the person, please, can I have a 15 minutes chat with you? I'm more inclined to accept a 15 minutes chat than for you to ask me for mentorship. So think of it that way. Let me have a 15 minutes chat with you to just ask you a few things around health informatics in the Kenyan health space, or in Nigerian health space, or in South African health space, because I'm trying to get into the industry, or I have done this and I've done that, and I'm trying to see how that aligns with what the industry is talking about in our country. So like build strong portfolios and include projects and all that, like I talked about. So organizations where you can work as a health informatics professional. So healthcare, Ministry of Health, hospitals, medical centers, these are all clinical. But insurance companies, healthcare, insurance companies, public health departments, pharmaceutical companies all need health informatics. Like we said, there's pharmaceutical informatics, research facilities, NGOs, the big NGOs need health informatics. I saw Africa CDC calling for application for a health informatics specialist. So they need informatics as well. That was my unofficial role. Big tech companies as well need health informatics people. So so these are some organizations, like I mentioned. You can go to their website to get more information around health informatics. Helena, HIMSS, even if you don't want to join HIMSS, there's a lot of information that is open to people on the HIMSS website about health informatics, AHIMA and MIA. So International Medical Informatics Association is the global one for health informatics. And career opportunities. So you have a possibility of working in the hospital and healthcare system. What are you going to be doing? Electronic health record implementation, like I'm doing, clinical informatics. This is the space where I operate, the first one. And the public health, government agencies, NGOs, international organizations, you can do disease surveillance, health policy, data analytics. In the pharmaceutical and biotech companies, clinical trials, pharmacovigilance, health tech and AI startups. There's so many things you can do there for them. And that's a very ripe space in Africa right now. MH solutions, AI-driven technologies, telemedicine, just know any of this and then add some IT skills to it and you're good to go. So academic research, teaching and insurance, can do claims analytics, fraud detection and the likes of that. And so these are the typical, I checked out for names, what we call health informatics people in Africa. Like if people are looking for jobs, like if they want to put out a call for application, what title would they give the person? So they can call them clinical informaticists. All these titles here are the things that you can take a screenshot, put this into LinkedIn, put this into Indeed if you're looking for a job. Don't just go and type only health informatics and tell me, oh, I didn't see any job because the title is not health informatics. It's different from pharmacist where it's only called pharmacist. So now you have them called so many things. So it can be, because it's a pathway, health informatics is a field and there are different career pathways under it. You can do so many divergent things under health informatics because it's a field and then there are pathways. So these are different job titles that people can have and be working in the health informatics space in Africa. So finally, I just want to say the things you need to consider is, what's your educational background? Are you in the clinical space trying to get into the IT space, trying to get some IT knowledge to cross over to health informatics? Or are you in the IT space, want to get some clinical knowledge, and now you want to get into health informatics? Education background matters. How do you upskill that? That's important to upskill. Where do you get the skills? We've talked about that, the courses to do, the soft skills, the hard skills, the domain knowledge as well. And then adapt your local needs and challenges. So you cannot go and start doing Senna or Meditech or Epic, which is a North American thing, when what is relevant where you are is DHIS2. So go and learn DHIS2 and open MRS rather than going to learn things that are not relevant to where you are. What are the challenges? So in your country, is telemedicine a big deal? Then go and learn things around telemedicine. Are there many apps around your country? Are people doing apps, codings and stuff like that? Then go and learn things around coding. So local needs and challenges, and then learn to collaborate with other people in the space. It's an interdisciplinary field. So it's very important that you learn these three key things. Adapt to the local context, always, always, and always. The educational background there, and then collaboration with stakeholders. So if you have any questions, we have about 5 minutes to go. I'll take questions now. And I know we've been answering the questions as you're going. So if you have any questions, you can put in the chat, or we can, and if you have, I don't know if they're allowing you to come off mute, but I think I put in the chat and we can answer them. But I've been checking the chats to see questions. If you have any clarification further, we can do that. 5 minutes to go. So anybody has anything to add? I've given the links to the courses, any addition, any questions. So go to optimize LinkedIn a lot. So after this thing, just go look for health informatics people who are health informatics or clinical informatics usually put health informatics in there. You find it in their tagline or their bio. Just search where you search for names, search health informatics there, and then you search people, put your country, and you receive people that are in that space, and then you connect with them and reach out to them. So that helps a lot. The links to the courses, I didn't share the links to the courses. What I did was to take a screenshot of this. These are some of the courses. So you can take a screenshot of this. These are some of the certifications, continuous learning courses. The universities I talked about are University of Cape Town, University of KwaZulu-Natal, Makerere University, University of Nairobi, WHO, ITU, Tech Change has a health informatics program that they do as well. Yeah, so I don't know if they're allowing us to share presentations afterwards, but I don't know if that's part of the package, but if they are, I'll share the presentation afterwards. So in the absence of questions, if there are any other further questions, you can put it there. And I hope this has been helpful to you. And I would like to get feedback, what you think. If you have any questions, any other things you want to add, you can add. I always, okay, presentations can be shared. Okay, I'm going to share it back with the organizers and they will share it with you. If not, I would have put a link for you to download it. I wasn't sure if they wanted that. So, yeah, so they'll share the presentation. So thank you so much. I would like to get your feedback if it was insightful, if it was, so please put in the Slido. I like to get the feedback. Thank you, fellow pharmacists. Let me have your feedback as we're wrapping up the presentation. So it can be anything really, as you are. So these are my contacts. You can reach out to me on LinkedIn, DMs. Please don't come and ask me, please mentor me. I can have I'm opening up a platform. So I'm giving out like 15 minutes mentorship time next week. So I'm going to put out the link. If anybody wants to take use of that opportunity, yeah, you can have a chat. You can also reach out to me on LinkedIn and Instagram. I'm active on Instagram. I think that's the one way I'm going to put up that information. So you can reach out on how, like me, I'm all about tailoring it to the context. So I've worked within the African space and I've also worked in the global north, global north. So the most interesting thing about my job is that no two things are the same, and that's also the most challenging. No 2 days are the same, and that's also the most challenging thing, is that you have to keep learning. The most challenging thing is that I have to keep learning all the time. I'm constantly reading policies. I'm constantly learning things. Things are constantly changing in the tech space. I'm constantly trying to keep up with AI, getting the best out of things. So the interesting thing is that it's not boring. So the person who asked me that question, it's not boring. What's your name? I don't know, Simbayoni. My job isn't boring at all. It's always interesting, but you have to keep up with the times. And it's yeah, that's one of the biggest challenges that you have to keep up. It's you just have to keep reading, you have to keep innovating yourself. If not, you're going to be out of a job. So yeah. Any other questions? So reach out to me. Let's chat. Like I said, I'll have slots for mentorship next, or to chat, not mentorship, to chat next week. And then it goes back to being paid. So if you're following me, you're gonna get that very quickly. So thank you, everybody. I think our time is almost up. And I really hope this was very helpful for you guys. And I'm going to stop sharing my screen now, and we'll see ourselves again. Thank you.
Thank you so much, Izine. That was such an interesting session. Thank you so much for really breaking down the health informatics pathway. Please, if you do still have questions, you can type in the chat session. We'll be closing all rooms, and other participants will be joining us very, very shortly. But then, as we welcome other participants, if you still have questions for Izini, you can type in the chat session and she would read them. Okay, closing all rooms now. I hope we had a great I hope we had a great session. I hope we had a great session. I can still see a lot of ends being raised in other rooms. Okay, so we'll probably do a 2.0 of these sometimes maybe next month. let's see how that goes, because I can still see a lot of ends being raised in other breakout rooms. They have questions to ask. So who wants us to do a 2.0 of this? You can just give us a thumbs up if you want a 2.0 version of this career fair, because I think some rooms have not actually finished. Okay, welcome back, everyone. Welcome back. Welcome back. I hope we had a great time in our breakout session. I don't know if we're able to wrap up. International agencies are still on the call. AI are still on the call. Startup innovation, genomics, grad school,
AI is
health data.
finished.
Okay. So are we done? Are we good to go? Do we have everyone back on the call now? Okay, that's great. Thank you, everyone. I hope we had a great time in our individual breakout rooms. I hope we're able to learn one or two things from our industry experts who are on the call, who are assigned or stationed to our breakout rooms. So
Yes.
right now, we just call on two people to just give us